Right, karibu sana. This is Morning Cafe. It's a Monday. It is definitely time to discuss matters health. And imagine this, a couple gets married and, well, everyone, the whole society is expecting babies definitely. But then months later, years later, well, nothing yet. And according to the society, really, mostly, the eye is always on the woman. But then, does the man have any thing to do with this? Infertility in men is what we're discussing this morning. A conversation that, well, most men really try to step back and not really have and say, ay, mimi niko sawa. But then, are you really okay? And to help us have this conversation is Dr. Victor Ngani. He's not a new face to these conversations about matters health. He's a medical director. Dr. Rasik Kantaria Jalaram Medical Services. Karibu sana, Dr.
Thank you, Stanley.
And I'm even definitely, should I say, concerned or, about the kind of conversations you have with men about this topic, infertility in men. Even before you start telling us what it is and diving really deeply into it, what do men tell you? The kind of men you've interacted with. What do they tell you about infertility generally?
Stanley, the first question would be, do men speak about it? And generally you'll find it's almost taboo. Before someone can seek help for infertility, as a man, it's very, very difficult. And it goes back to a matter we'll discuss today, which is basically the stigma around this very topic. As you've rightfully said, many times when couples are not able to have children, they sort of tend to blame the woman, and the general perception is that the man is fine. That's not always the case. And so this kind of conversation, the idea is to let people know that, number one, the purpose of marriage is not necessarily to have children. That is not medical, it's just something else you need to pay attention to. And then to understand that this actually affects both parties to a large extent, and that there's help that can be obtained. And then to encourage us to speak a bit more, because the impact of not discussing infertility can be quite significant. I mean, it actually does affect lives for years. It affects relationships. It affects how men view themselves, and it affects how you operate in every other sphere of life, whether it's work, whether it is social circles, whether it's family. It's a really big issue that we're discussing today.
Right. Allow me to take a look at some numbers and what the situation is globally. We'll start with how the global numbers look like. This is according to World Health Organization. It says 20% infertility cases are attributed to men. At the same time, 27% infertility cases attributed to both men and women at the same time. So that's globally. Let's narrow it down to Kenya. 30% of infertility cases are attributed to men, and this number is similar to that for women, the 30%. They also say 40% is to unknown factors. This is according to the Kenya Fertility Society. It also says 1 in 5 couples suffer from infertility challenges. You'll be telling us more about that. It also says 4.2 million Kenyans who require medical assistance to conceive. The World Health Organization also lists a couple of the common causes: obstruction of the reproductive tract, problems in the ejection of semen, absence or low levels of sperm, hormonal disorders, smoking, excessive alcohol intake, as well as obesity. And we'll be running through most of this. But then I always love to taking a look at how, if you talk about infertility, the specific body parts that are involved here. Walk us through the anatomy, really. Help us picture and paint us a picture of the anatomy of everything that happens here.
Okay, Stanley, I'll surprise you that the reproductive system for men starts at the brain. So we'll come to that. But before we get there, could I just take a moment to explain what infertility is?
Yes, please. Because
there is this misconception, and you actually mentioned it as you're giving as you started out, that you're married and a few months later, you not had a baby and everyone is worried. And that is true. The grandma is at your door knocking, asking. So it's important to understand that infertility is defined differently. It means that the couple is engaged in regular intercourse, and regular here is about every 2 to 3 days throughout the cycle itself, and they're doing this for about a year, and they're not able to conceive.
Yeah.
And in fact, if you're a young couple, we may even give you up to 2 years because you have a bit of time for evaluation. Although if the lady is above 35 years old, then we try and reduce that period to about 6 months. So generally we speak about 1 year when you're not able to conceive. As a couple, despite regular intercourse, then we say maybe there is infertility here. And this is important because many couples may take even a whole year, more than a year plus, not conceiving, but they actually have no issue. So it's important to take note of that. Now, in terms of the anatomy of conception, the production of fertile sperm actually goes through a couple of things. The first is there are hormones that regulate this process. And so it starts at the brain, a place called the hypothalamus, that produces the initial stimulus, telling another part of the brain to produce a hormone that then hormones that then support the production of spermatozoa. Spermatozoa, this is basically the male component of reproduction. And these hormones are produced, luteinizing hormone and FSH, and then they go down into the testicular region, and they promote the growth of the spermatozoa within the testicular region. And after that, during intercourse, then they have to walk through a very rough journey because the pipe, let me just use it, they call it that, that transports the sperm from where it's made to the outside is a very long and tortuous one. It goes backwards, curves over the bladder, then goes through the prostate, then follows the urine pipe all the way until it comes out. So these are essentially the components of the anatomical components of reproduction in men.
Right. So now how does one know that they're probably infertile? So walk us through, let's say, the sperm count, also the diagnosis really.
So the initial thing is, as I've mentioned, there are different spaces where you can get infertility, and that means you can actually categorize infertility into different components. So when you talk about something called primary, hypogonadism, primary, that's a big word, but basically it's saying that the production of sperms is not where it's supposed to be. It means that the problem is within the testicular region itself. The male, the testes themselves are not able to produce good quality sperm, or they're not able to transport them effectively to the outside world. Then secondary is when a lot of these problems are arising from the brain, where the hormonal production, the hormones that are very important in supporting this growth of sperm, these hormones are not either being released as they should, or the body is not sensitive enough to these hormones. And so that tells us, if you want to assess you for infertility, then you must start from the brain level. We can look at the hormones themselves, measure the quantities. Is it at the level that we're expecting? If the hormone levels are too low or too high, they tell us something. Now, if we suspect that there is infertility because of these hormones which are being produced at the brain, then we can assess the brain itself and check for, do an MRI, do other studies to assess if there's anything that's going on in that space. The cornerstone of this assessment for men is actually what you said, semen analysis, which is basically looking at the semen itself, looking at the quantity, looking at the sperm count, looking at how mobile they are, and then the shape of the sperms that come out of this. Do they meet certain criteria? This is the other element that will then go ahead and look. And there are a number of investigations as well that can be done depending on how severe the matter is. Now, a lot of infertility is caused by genetic factors. Genetic factors means there is, an example is a situation where instead of having 46 chromosomes, you actually have 47 chromosomes. You have two X's and Y. This is, it's called Klinefelter syndrome. But then genetic studies can tell you whether there is any abnormality that then we need to address in that space.
Right.
Just as examples, yes.
And as you rightfully say, the kind of semen analysis and even the diagnosis that for a gentleman who goes to the general practitioner, the number of sperm, the proportion of sperm that can swim, which you doctors would call motility, as well as the sperm shape, which again you call morphology.
Yes, the shape, yeah.
So at what point does a gentleman go to get this semen analysis? Because as I was starting, I said, this man doesn't have any idea. He probably, at the back of the mind, he knows I'm pretty good. and then a couple of years of trying, nothing really, no child. So at what point will you advise a gentleman to get a semen analysis?
So we'll walk it back and think of infertility not as a woman infertility, man infertility, but as a couple, an issue affecting a couple.
A couple, okay.
And so whenever a couple is not able to conceive after regular intercourse, remember what I define regular as, over a period of 1 year, then that is a time to see a specialist. And there are two types of specialists you're going to see in this conversation.
Okay.
One is the obstetrician gynecologist. This is the obs-gyn, daktari wanawake, whom, we have quite a number now in the country, and they're extremely good, and they've actually done a lot of work in this area of infertility. The second specialist you want to see is a urologist. Urologist is a consultant who looks at basically the system that relates to, you'd call it the urinary system, but then in reality, it also includes the testes, includes these reproductive organs, especially in men. So male infertility in particular, the urologist takes center stage in addressing this. So you'd see a doctor. I'd start with any doctor within your environment if you can't access a specialist. And what we'll do is take a history. Even as you continue, because you're saying, and rightfully, even WHO tells us that you really have to have the timeline of 12 months yes.
For continuous unprotected sex, and you don't get pregnant. That's what it defines as infertility. But then this man does not really want to wait until he gets into the marriage institution to actually wait for that whole year. He just wants to know that before I get here, I am okay. Can that be the case?
Yes, it can, although it's not something that you do routinely, because then the question is, the impact of that is also significant. Yes, you can actually get seminalisis done. This is possible. You can sit and see a specialist early, like a urologist, have a conversation. And the first thing the doctors will do is actually take a full history, because there's a lot of factors that affect fertility in general. We will not discuss those. For example, have you ever had sexually transmitted infections? What other health challenges might you be facing in this generation? There are factors, lifestyle factors, which we'll get to, that can affect your actual status. Then someone to do a thorough examination. Actually, a lot of children are born with either descended testes or something that is not exactly the way it's supposed to be. And there are some complications that arise. Something like varicocele, where the veins in the testes are a little bit bigger than they should be. And this can be reversed, actually. So having this assessment would be useful. Although I'm not sure whether it's something you want to do, Stanley, before you're in the marriage setting, because then it fills with anxiety. In fact, I'd want us to think of this as a conversation affecting couples as opposed to conversations affecting individuals. That said, you can take some measures as an individual to improve your well-being, to improve your chances of, reduce your chance of getting infertility, because there are some things that are modifiable. There are things you can do today to improve your overall health, not just in cases of fertility. Things like...
And the reason I'm asking that is because even according to Kenya Fertility Society, it says 1 in every 5 couples. So if you had about 5 couples here, 1 in these 5 couples is suffering from matters fertility,
yes,
this whole infertility challenges. So, and this is always a conversation that even in circles of men, they probably just talk about them in a subtle manner. Sperm count. So typically, first of all, what is the recommended sperm count that you'd say the GP would probably look at and say, you okay?
Stanley, I'm not sure this is the... Okay, let me put it this way. For the men in the conversations that we have, I wouldn't want you to be in a space where you're saying, I've gone to see the specialist and I've asked for a sperm count, and the sperm count that has come in this way, now I feel that I'm okay or I'm not okay, because the evaluation in fertility is much broader than this. And I would really, really want to ask our men, as you listen to me, this is not... there's a lot of stigma around this conversation. You don't talk about it. And I don't want you to get into a space of worry where today, because you've heard me say what I'm saying, you're going to walk out of this place and go to the next place to get a sperm count done, because unless you're having an issue with infertility, please let us not be in a space of worry. Let us begin to have these conversations. Let us not put it as a taboo conversation per se. Most importantly, what I'm trying to do is remove the anxiety related to it. If you were to talk about the investigative process for, can I say, infertility.
Yeah.
A sperm count is just one of those conversations, but it's not. And even in the semi-analysis, sperm count is just one. You still look at the shape, you look at the how well they move, the quality, the volume of the ejaculate as well. So all these factors would not really fully deal with the whole conversation in fertility. I don't know that I'm communicating I don't know that I'm answering the question that you want me to answer, but I'm also passing up across a point. And I'm saying that if you're not in that space, there are a few things you can do to improve your health that will improve fertility, but worry is not one of those things. In fact, worry is something that will negatively impact fertility, even for men.
And the fact that you've brought up that conversation, things that you should do to even better. So what are the things, because taking a look at 1 in 5 of this couple, in every couple, has infertility challenges, and men play a huge factor in this. So this man at the back of the head, if they came to you as a GP and you tell them, well, pole boss, lakini ni kama kuna shida. So at the back of the mind, this gentleman is trying to wonder, what have I been doing wrong? Probably it's a 30-year-old man, and he is trying to wonder, what have I been doing wrong all my life? Mm-hmm. What has he been doing, quote unquote, wrong? Okay,
so again, I'll come back to the issue of causes. Mm-hmm. And for quite a big proportion of infertility, both for men and women, are actually not as a result of something you have done. Okay. It's normally either genetic factors or an abnormality in the transport system, or there are quite a number of things that can actually go wrong that will not be down to what you can do. However, there are certain things that you'd actually take that to some degree, not the majority, to some degree can affect your fertility situation. And again, the thematic thing we're doing as doctors now is removing the blame from the individual. And every time you see a couple struggling to conceive, I want us to understand it is not that they've done something particularly wrong, or that they're guilty of something, or that there's something that they've not done that they should have done, or that they're defective in any way. No, it's just that this affects 15 to 20% of couples, and actually for over about 40% of those patients, as you rightly said, we may not entirely know what the reason is, 20 to 40% depending on the setting. So what are these things that you can do that will affect your fertility? Number one, excessive alcohol intake. Jamani, this is not good for you in general, and I'm not talking about infertility only, but yes, it can affect your fertility. Number two, smoking. Smoking has no benefit. Well, there's that small feel-good effect, but the harmful effect of smoking, every topic we discuss here, Stanley, smoking is in the sin bin. It's something you really want to stay away from. Then the use of anabolic steroids. So we sometimes, growing up, you're told you can use steroids to help build your muscles and things like this. And yes, those positive things could exist, but every item that you're taking has its own negative effects. So these are, I'm highlighting the 3 most common ones that can then affect you. Then your sexual habits can be significant as well.
Before you get into the sexual habits, because you've mentioned drug and substance abuse, and I'd love to also throw in one of them, and particularly just narrowing it down to Kenya and what you relate to. And I'd love you to tell us and guide us if this is quite correct, because over the years we've always been told that miraa is also one of those factors that can cause infertility in men. Is that true? And if so, how?
Absolutely. So one of the things that we've known across border for all, actually it's not just when I speak about alcohol and cigarettes, actually a lot of recreational drugs can actually affect fertility. The precise mechanism is not determined, whether it's for cigarettes, whether it's for alcohol, whether it's for marijuana, whether it's for heroin, these recreational drugs. What has been shown over time and time again is that actually fertility amongst chronic users or abusers of these particular items, it goes down significantly.
What exactly happens that if you indulge in the substance use, does it lower the sperm count? What exactly does it do to infertility in a man?
Yeah, so what we are saying is the precise mechanism, how these associations happens is not well determined. And this is what you're going to find across all the substances that you're using. Of course, there are certain drugs we'll give, for example, chemotherapeutic agents where we know exactly what's happening in that space. We'll talk about, but then the mechanism is not determined. But when you look at the data, it shows you that actually those who are actively involved in this, then you can have a reduction in infertility for men, yes.
Right. And so this person comes to a general practitioner. But then, so first of all, what kind of questions do you ask him? So if probably he came alone and decided, leo sikuji na my other significant person, what kind of questions are you running through with him?
Yeah, so we're looking at their history in total. Number one, a couple of things will give us cues as to whether they have any health issues. Is there anything that's affecting you now that can affect fertility? Any severe illness can do that. Kidney disease, diabetes, any of these issues would actually be problematic. We'll look at your puberty. How was it? Did you develop the features as expected? Did it come early? Did it come late? Is it normal, or is there any particular issue that stands out? Because some of these can in fact be the indicators that there is a genetic thing going on that's affecting you. Then the same thing, is there anybody else in your family who's ever had infertility? Because then this can also be an indicator that there could be something genetic that is going on within the family. Then you look at your sexual history. Is there any history of having had sexually transmitted infection? We look at issues around trauma. Have you ever had something hit you around the testicular region, because that trauma can also cause infertility? Have you ever had any surgeries that can affect you? Do you have any pain, any infections that would be affecting the testicular region? And all these things can become significant. Then we'll do an examination, look at you from head to toe. What is the structure? Does it look normal? We'll ask you about within the sexual space, have you had any issues such as erectile dysfunction or premature ejaculation? And then the instances when we'll discuss issues like retrograde ejaculation, and all these factors put together can then give us a bit of guidance. Have you ever had children? How are you actively engaged in intercourse? There is one area that is not discussed because it's very rare, but it's also common and need to be paid attention to, which is there an awareness of how reproduction works physically? That's also just something as well that you'd have in this kind of a conversation.
Right. Yeah. And speaking of questions, you can always throw them in. Our phone numbers are open 30 minutes past the hour. We've allowed you to also understand this conversation with Dr. here. So right now, write this number down because you definitely need it right now. 0795 045 864. It will be just below your screens, and just look at it carefully, write it down, and then call us live. Our team will be picking your call. Tell us your name, tell us where you're calling us from, and when you do so, have your phone, have your TV, have it mute or have it off, and then tuulize yo maswali yote yenye uko nayo concerning specifically this conversation, infertility in men. And either a question or a feedback, we definitely will be very, very happy to answer all that. If you prefer to text us on WhatsApp, 0793-267-279, I'll be taking a look at your questions, which I really can see a couple of them right now. 22047 is our SMS number. TV47KE on Facebook is our handle as well. Daktari, as you continue, someone says, hi, I'm Caleb. Kindly ask Daktari if infertility means I'm also important.
In terms of terminology, infertility just means you are not able to conceive. But in fact, in reality, you are able to, the instances when you'll find that you actually have viable spermatozoa, and we just need a bit of help. Either because either some hormones are missing, we can go ahead and give you some hormones to make your reproduction a little bit better, or there's a process where there's blockage, or there's something preventing physically the transport of spermatozoa from where they're created out into the ejaculate. So there could be a small technical distinction there, but in reality you can be able to conceive, and many couples are able to conceive and actually are able to have children with a bit of assistance. So I'll make that distinction. I hope that is quite clear.
Right. Amesi says, uliza doki kama consistent and regular sexual activity in a man can make him infertile.
No, that is not the case. However, if you have intercourse, okay, we say frequently. Frequently, we mean at a bit 2 to 3 times, every 2 to 3 days. However, if you
in a week?
Well, every in the cycle is about 28 days approximately.
Okay.
Every 2 to 3 days, that's good enough. And if you make it extremely frequent, which is not usual every day, but then several times a day will actually reduce the sperm count significantly, because every ejaculate, you know, you're emptying what is there. So it's important to note that excess frequency is also not good. So anything between every 1 to 3 days is good enough if you're trying to address the question of infertility.
Right. Wacha tuchukue simu ya Douglas kutoka Kakamega. Douglas, habari ya watu wa Kakamega na habari ya asubuhi.
Tunashukuru Mungu kuona siku njema.
Hata sisi tunashukuru kwa first of all kutupigia simu. Uko na swali, uko na maoni?
Niko na swali.
Yes, uliza.
Nilikuwa nauliza daktari. Hii cause nini, masturbation, does it cause infertility also?
Okay, sawa. Right, hold on to the line, and actually you can just, because he's listening to you, so he asked, does masturbation cause infertility?
No, it doesn't.
Douglas, umepata hiyo jibu? Oh. Okay, Douglas amepotea.
Yeah.
All right, because I'm pretty sure he's expecting even a detailed explanation on that, and just not a no.
Okay,
so and I think it also ties to what you were explaining to earlier. Yeah.
So allow me to just then recategorize the causes. So number one, you can have the problem with the hormones coming from the brain. Then you can have a problem with the structure of the can I say the male, can I say factory for creating sperm. So either it's not well formed or there's an abnormality there. Then there could be a process, an issue with the process of transportation from where it is. And so the things that will cause you infertility would fall along this chain of things that I've described. And you can see that masturbation in particular is not falling in that category. It may have its other issues that would be social in nature. It may affect your ability to engage socially. It may affect your ability to perform effectively. These are not really... it's a social impact, but it's not causing infertility from a physical point of view. It's not going to reduce, can I say, your hormone level, or it's not going to reduce your ability to generate spermatozoa in this way. Yeah.
Right. 0795 045 864 is the number to call us. Your name, where you're calling us from, have your phone, you have your TV mute. Also, have your questions, parental guidance, PG rated, by the way. Usiulize a very watershed hours kind of question. Make sure pia unaangalia masaa ya kuuliza hii maswali, and then daktari will be answering them. And because you also mentioned that, so let's talk about and just clear the air on some of these things that we have on the street. Tunaambiwa kula njugu vizuri, tunaambiwa tafuna seeds za pumpkin, mukombero, as you know, commonly known, the whole root, and so many others. Walk us through how, because I mean, you're saying some of these things, some of these activities lower the sperm count. So what now increases the sperm count? Does this increase the sperm count when eating some of these nuts and also roots? Okay.
So if you were to speak about the things you can do to promote fertility, then you'll find healthy eating is a big part of that. Then remember that in addition to the question of sperm count and production itself, there's still the social aspect of reproduction. Social aspect has to do with the attraction, has to do with the physical performance, has to do with quite a number of things. And then you can see then there's another aspect of fertility that can be addressed through, say for example, interventions that promote physical activity, that promote your ability to engage in intercourse, things like exercise, those kinds of conversations are important. But then in terms of fertility itself, there's a very big role for healthy eating, and we've known for the longest time that nuts and are generally very good for your health, not just in this area, but in many areas as well. So adequate, not anything you do, don't overdo it, but engaging, having nuts, this has been shown to, and grains, just healthy eating have been shown to promote good health, and good health even for the spermatozoa. Mm-hmm. Yeah.
Right, so you definitely encourage even the consumption of some of this.
Yes, if it's something that you know what it is, and it's a natural food that has been there for the longest time. Groundnuts, for example, it has some very nice oils that are healthy for you as well, not just in this space. But then you have to be extremely cautious. On the other side, do not take these concoctions that people are giving you, that this is a concoction that has been made from some rare herb in China. It's rare and it's everywhere in the world. There's no way something rare you're going to find it, So be very careful, because anything that you're taking, you need to know what the side effects are. So if it's food, someone is telling you take this food, it's green, they're nuts, then go ahead and do that, because that's good for you, and that's the general guidance that you'd find. But anything that you don't know what it is, it's processed, someone has mixed something, some concoctions, they're giving you that this is good for your health, some roots that they've boiled and herbs, please don't do that. Those could actually harm you and work against your interests.
Is there any specific vitamins in some of these foods and nuts and roots that you're talking about that one should probably target?
So fruits and vegetables have vitamins, and for the purpose of this conversation, understand that vitamins are very good for you. So greens, fruits, nuts, these are generally very good for your health and will help you when it comes to issues of infertility.
Right, fantastic. On WhatsApp, 0793267279. Hi, I'm Philip. I am overweight, about 93 kilograms. I recently, about 2 years ago, visited a GP, and he told me that I am infertile. Does that have anything to do with, just getting a clarification, does that have anything to do with that? But then even as you answer that, I'm being told that we do have Rose. Kutoka wapi Rose? Kutoka Rongai. Rose, habari ya Rongai?
Yeah. Hello?
Hello, yes. Good morning, Rose.
Niko na swali. Kijana wangu alikuwa na shida ya akiwa vile limzaa, after 2 years akawa na shida ya testis moja ikapanda. Alafu sasa kama saizi naonanga huwa high erect kama vijana wengine hao wadugu zake.
Okay.
Yeah.
Right. Wacha daktari atakuwa na kujibu saa hii tu.
Saa hii ako 8 years.
8 years.
Yeah, and huwa high erect akiamka.
Okay.
Right. Lakini ndugu zake wako sawa.
Okay.
Njibu please.
Right.
Asante sana Rose kwa hiyo swali. Daktari atakuwa anajibu tu sahi.
Maybe I can ask Rose, has it been corrected? Amefanyiwa operation tayari imerekebishwa?
Alifanyiwa surgery before afike 2 years ikateremshwa. Sasa sasa naonanga hayuko sawa. Hiyo yake ni kadogo, kapenis ni kadogo. Alafu haielect.
Okay, ukiwa na wasiwasi nitarecommend kwamba uone a urologist, lakini at 8 years bado uko mchanga sana, usiwe na wasiwasi sana. Mpe time mpaka tufike wakati wa puberty, then from there we can have a conversation with the doctors. We'll see how he develops. Usiwe na wasiwasi sana wakati huu, kwa maana kile ambacho ulikuwa unapaswa kufanya ulishafanya akiwa na miaka 2. Kama mzazi umefanya kutosha, hivi sasa ashughulikie masomo, akule vizuri, usiwe na wasiwasi at all, and hiyo isiwe a conversation ambayo inamhusu, inaweza mpa stress ya bure na ataenda akapata watoto 10 huko nje. So mpe tu muda, wakati wa puberty mtajua kutoka hapo.
Puberty inakuja after how long?
Puberty ina differ. umri inadifa, but mpe tu early teenagehood. Hapa akifika teenager hivi utajua, utaanza kuona kama ile voice yake inaanza kubadilika, anaanza kupata tundevu hivi tuwili. Wakati anaanza hivi, ya mpe tu time. Watu wana tofautiana. Kuna wale ambao watapata puberty mapema, wale watachelewa kidogo, lakini wakati wa puberty utajua. Na isiwe jambo la kukutatanisha. Cha muhimu ni kwamba ulishafanya marekebisho yale undescended testes.
Okay.
Naam.
Thank you.
Asante sana pia Rose kutoka Rungai kwa kutupigia simu. Salimia sana watu wa Rungai. 0795045864 is the number to call us live. Use this opportunity to ask Daktari all those questions regarding male infertility, a conversation that tunaogopa kupiga. If you're a man unaona watanisikia nikiuliza hii swali, patia mtu ako kando yako kuulizia swali. At the end of the day, bora swali imejibiwa. Yes. So before Rosa's question was Philip. Hi, I'm Philip. I am overweight, about 93 kilograms. I recently visited a GP and was told that I am infertile. So I just want a clarification on that.
Obesity also has an impact on fertility. So it's an important conversation to understand. And so bringing your BMI is controversial, but it's something you understand. Bringing your BMI, body mass index, to a decent level is good. Basically, if you can reduce kitambi, it has a lot of benefit, not just in fertility. But it's important to note that that is just a very small factor in the overall conversation. If you have trouble conceiving, there's a lot of assessment that needs to be done. And I hope I've passed the message. There is a lot of, starting with the hormones themselves.
Okay.
This should be assessed. Seminalisis has been the focus for a lot of people, but there's a lot more to do than seminalisis, even though that is the cornerstone of assessment in many areas.
Let's pick this call and we'll continue with what you're telling us. Samuel kutoka Migori. Sam, habari ya asubuhi?
Very well. How about you?
Thank you for calling us this morning. Utapaza sauti kidogo tu. I hope umemute TV na umemute ama umezima TV?
Yeah, nimemute.
Thank you very much. Uko na swali au uko na maoni?
How best can we reduce obesity which affects fertility of men?
How best can we reduce?
How best we go about obesity because it can affect the fertility of men.
How best do you go about it?
Reducing obesity?
Yeah.
Okay. So do you, anakusikiza sahi, he can answer you live on air before tuendelee. Do you pia clarify more questions?
Okay, so obesity, a couple of things. The first that you want to do is watch what you eat, healthy eating. Too much processed food, fatty foods, all these things that we now love from the respective brands, we want to moderate what we are taking in that area. Number two, exercise. Exercise is good generally for you. And when you talk about exercise, what I'm recommending is that 3 times a week, something that makes you sweat, something that makes you pant. This is going to be very useful. And ideally, you want to engage in physical activity throughout the day. So these are the 2 most important components if you want to actually bring down your weight. But then remember this one thing, consistency. It's not as if you're going to work for about a month and then you see miraculous changes. You have to be consistent over time to begin to see these benefits. There are things that you can also reduce within your food, things like excessive sugar. Sugar is going to be transformed into fat, excessive fat. All these things can then be reduced in what you're consuming as well to reduce obesity.
Right.
Yeah.
Right. Thank you very much. Sam, najua umejibiwa.
And some vitu kama pombe, yeah, pombe has a very, eventually, you know what it does to you. So if you want to reduce obesity,
right,
punguza pombe pia.
So asante sana Sam, salimia sana watu wa Migori. 0795045864 is the number to call us live. And so even as you continue, because you've answered what I was asking about matters obesity, you've definitely answered it very nicely. So now I want to get into something else about age. Does age matter in this conversation? For example, someone decided to not get kids until they're probably past 40, in their 40s, and then now in their early 40s, their mid 40s, they decide to start this whole process. Are they in? Would you say chances of infertility might be higher regarding and relating to someone who is in their very early
Stanley,
ages?
yeah, I get it. The answer is not zero. The risk is not zero, and there is an impact of age on men, but that impact on age is much, much less than what we see on the female side, and it's not as significant. And so you can expect someone to get a baby at the age of even 90 years plus, but then the age does have a factor, does play a role, but that role is very, very limited, and certainly not the age of 40 versus 20. There is almost negligible. So the answer is not zero, but it's not as significant. I wouldn't stress over age with regards to fertility for men.
Right, right.
For the ladies, it's significant because,
right.
yeah.
Right. We have a caller from Lamu. I believe it's Cyprian. Abdul, yes. Habari asubuhi kutoka Lamu.
Nzuri kabisa ndogo.
Yes, naomba utapaza sauti yako kidogo tu. I hope umezima TV. Uko na swali au maoni?
Punguze runinga.
Yes, tafadhali punguza.
Sawa, asante, nashukuru.
Endelea na swali.
Sasa swali langu kwa daktari ni ni naona my penis kidogo imeshrink ndani inwardly. Hello, unasikia?
Yes, endelea. Tunakupata.
Alafu the left testis nayo imekuwa kama kuna maji yameingia hapo ndani. Nikaenda Kenyatta Hospital wakapima, wakaniambia hakuna shida hapo kabisa. Sasa ile kitu bado inanisumbua tu, inarudi tu inwardly. Sasa hii shida inaweza kusababishwa na nini? It depends also change in color. Imekuwa black kabisa.
Hebu niulize, uko na watoto?
Nina watoto.
Una watoto, naam. Sasa kile ambacho ulipata ni kwamba ni kama moja imeingia ndani, lakini wakati ule ambapo ulipimwa ukaambiwa iko sawa.
Naambiwa iko sawa, the testis yote ni sawa. Wanasema the left testis kidogo kulikuwa na maji ndani. Sasa wanasema hata hii maji hatujui kitu gani kinasababisha, wakaniweka kwa skani, wakaona kila kitu ni okay. But still I have that problem of now the pain is shrinking. And your desire sex has hakuna.
So I'll tell you, one of the biggest problems you'd face and men would face generally with issues around sexual health is anxiety and stress. So kile kitu ambacho kinakupatia wasiwasi, hata wakati ambapo umeambiwa kwamba uko sawa, bado wasiwasi inaendelea, it actually works like a vicious cycle. Kwamba inapunguza your performance, inaongeza stress, inapunguza performance, inaongeza stress, inapunguza performance. Cha muhimu ni kuacha wasiwasi kuhusu jambo hilo. Kama umeambiwa kwamba iko sawa, I'd recommend you see a counselor ambaye atatembea na wewe moja kwa moja. Unaweza kuja mahali ambapo tupo pale Dr. Rasik Kantaria, tuangalie jinsi ambavyo unaweza tembea na mtu moja kwa moja ile wasiwasi ipungue, kwa sababu hiyo wasiwasi will be the biggest reason why you cannot perform. And the reality is, wakati ambapo wasiwasi iko, then performance inapungua, na ikipungua then inaongeza wasiwasi, and it becomes a cycle ambayo ni ngumu sana kutoka. Itafika hata wakati ambapo inaweza kuwa erectile dysfunction. Lakini ukiweza kudhibiti hiyo wasiwasi, utapata kwamba kila kitu kinaanza kuwa sawa.
Daktari, hapo hakuna wasiwasi, shida ni the penis yenyewe ina shrink kabisa.
I'm struggling to hear that.
Rudia tena tafadhali Abdul.
Nasema the penis hiyo bakora ina shrink, inarudi inwardly.
Okay.
Na ilibadilika rangi, ilibadilika.
Okay. So because kwa maana tuko katika ile on air conversation, kuna ningependa tu labda niseme kwamba tuweze ukafika kuona specialist ambaye anaitwa urologist, ujadiliane na yeye moja kwa moja. Kama umefika Nairobi pia unaweza fika mahali ambapo tupo, alafu I link you up with a specialist to have a conversation. Lakini akikwambia kwamba iko sawa, tafadhali tufuate hiyo, kwa sababu kuna vitu ambavyo itakupa wasiwasi na ipunguze ile performance. Na hiyo I've understood what he's saying. I don't want you to worry much about it, but have a conversation with a specialist who will tell you if there's something wrong or not.
Right.
Yes, a urologist to be specific.
So asante sana Abdul kutoka Lamu. Salimia sana watu wa Lamu. Thank you very much for calling us this morning. I'm still seeing more questions here. Hi, I'm Sila. I am a regular cycler. Does it mean that I am at a high chance of being infertile?
Trauma. So you have to be very careful about trauma, and then you will notice that the male testicular region generally tends to be in a place where it's meant to have a bit of aeration, it's not meant to be tight and squeezed. So those are the things you have to pay attention to, because if you wear extremely tight clothing, that creates tremendous heat and then causes a lot of trauma where consistently it's being hit, then there are risks there that you have to be careful about. Yeah. But if you're able to be judicious, use a good saddle, then you should be fine. You don't wear excessively tight clothing, then you should be fine.
All right. That answers Felix's question. He was asking, does tight underwear risk on matters infertility? You've definitely explained all that. So we have very few minutes to just wrap it up. Your clarion call to someone listening to you this morning, either a man or just the couple, they're sitting there looking at each other and they're like, ama leo ni ile siku yenye tunafaa tuende tuangaliliwe, you know, just to be sure.
Number one, kama you've stayed is less than a year, forget about infertility, relax. And in fact, relaxation is very good for conception. That's number one. Number two, sio kwamba ni wanawake peke yake. It's about 35% women, 30% men. That is the general spread. And you need to know that there could be, if you're struggling to conceive, it could be a factor that's affecting both of you. That's 15%, both factors. Then 30% men only, 35% female only. And others, you don't even know what the reason is. So address that as a couple. And something that I say that is not medical per se is that couples need to know that you are not your children. There are couples who are destined to have children, those who are not destined to have children. And even for those who struggle to have children, there's a lot of help that you can receive now within the healthcare field. We didn't even discuss that. Treatment for infertility, there's a lot of treatment. You may struggle to have children, but within a few, even without IVF, you can actually find that you're able to conceive. And IVF is still an option, and there's a lot more that can be done. So you shouldn't be in a space where this causes a drift. The moment you struggle with infertility, please seek help. Seek help, see specialists, and you may not have to discuss it with people in the community, no problem, but with the doctor, please embrace that conversation. Have that conversation. You may find that it's something that can be corrected and actually helps you easily.
All right. A quick food for thought that as a medical practitioner, you can also walk us through. Top of my mind, I'm thinking, because most of the men are don't really want to approach you as a GP and talk about infertility really. So are there right now advances in technology, because we're living in a digital kind of a space, that they can actually just do this at home?
That's a very leading question, Stanley, but I get your point. And again, basically what you're telling us as healthcare practitioners, you're making a good suggestion, because now we have all these options like telemedicine, right?
Yeah.
And telemedicine, you have the option of turning on your video or not, and you should make that space safe. Of course, my preference is that you have a physical meeting, because in addition to history where you have a conversation, then there's also room to have an examination. For example, our caller from Lamu, what he was, the question he was asking requires that we have a physical meeting and we do an examination, then we tell him, no, this is what is happening. Yes, there are other factors in history that are contributing, but an examination is important. But you're right, Stanley. We should have telemedicine within our platforms so that we're able to, you don't have to come to Nairobi to have this conversation.
Yeah, and not only even telemedicine, test kits. Are you even able to have test kits even for your sperm count and just a whole semen analysis at home?
Yes, actually, that's been there are certain kits that have been developed around that actually work. But then, where we're moving as a country is a space called accreditation. So this is a pretty sensitive kind of a conversation. And whenever you have this test, I would strongly recommend that you have it done in an established and well set up center, so that whatever results you get are results you can count on. And the important thing that I'm really trying to push is to remove the element of worry, because it's that worry that creates really strain. Then I'm also trying to remove the concept of blame. Don't blame yourself, don't blame your partner, because that is what then creates strain. And none of these things work in your favor. You may end up having a child, but in a space where the family dysfunctional now because of all the strain, and that's not good for family.
Right. Dr. Victor Ngani, thank you very much. He's a medical director at Dr. Rosik Kantare Jaharam Medical Services. Thank you very much for having this wise nuggets even for us. Thank you very much for those who texted us on our social media handles, those who call us live and got their answers. In case you unafikiria bado kuna maswali nyingi zaidi, a quick one daktari, just to your telephone number that they can now direct all these questions to you, then tukafunge.
What I'll do, I'll give you the number for the contact for Jalaram. That's okay. Jalaram Nairobi at
yes, please.
.org. This is our facility, and you can visit us at Westlands opposite the Oval. It's a very nice big facility. Please come in and see our facility.
Thank you very much, yes. Dr. And that is where we definitely wrap it up. Coming up next is a whole practical conversation that you probably have some breathing problems, snoring, umeamka asubuhi na unaambiwa na mtu, wewe una snore sana bana. But then how can you even